I discovered that I had heart problems when I could feel my heart beating in my chest, and I could feel that it was beating irregularly. As my condition worsened, the doctors that I was seeing kept putting me on more and more medicine. Different types, beta blockers, different things that I was not handling very well. And I was really getting slowed down. My pace slowed down quite a bit. But living with the pacemaker now is a great thing. I never think about it. It's been a wonderful thing for me.
Well, what led up to me being diagnosed with bradycardia, I just got awfully tired, and walking was one of my greatest assets. And I found that I was so tired I could hardly get back to the car, but I didn't attribute it to anything, you know. Well, after the procedure, I had to go in every month for a while so that they would check it. It was quite an improvement in the way that I felt. I've not experienced any of those tired feelings. As a matter of fact, I don't even remember that I had a pacemaker.
I was 5 years old when I got my first pacemaker. What I remember about my life before I got the first pacemaker was I was always tired a lot, and I couldn't run for very long without having to stop and take a breather, and everyone would have to run ahead of me. I remember being in the waiting room, and I wasn't that nervous, and then I remember being on the table, and I fell asleep, and I remember waking up. Ready? Mm-hmm. Yeah, I remember I had more energy. When I think about the future, I don't think about the pacemaker at all.
A healthy heart beats about 100,000 times a day, and it pumps nearly 5 quarts of blood each minute. That's 75 gallons of blood every hour. Bradycardia is a slow or irregular heart rhythm, usually less than 60 beats per minute. At this slower rate, the heart is not able to pump enough oxygen-rich blood to your body during normal activity or mild exercise. Symptoms may include dizziness, lack of energy, and shortness of breath.
Bradycardia can be caused by heart disease like heart attacks or heart disease like viruses. Bradycardia can also be caused by medications used to treat heart disease.
Common causes of bradycardia include a hereditary heart defect, certain illnesses or heart medications, the natural aging process, scar tissue from a heart attack, sick sinus syndrome or sinus node dysfunction, and heart block. For patients with bradycardia, the heart can beat too slowly for 2 primary reasons. First, there's sinus node dysfunction. This means the heart's natural pacemaker, called the sinus node, is not functioning correctly. And second, there's heart block. This means the electrical impulse that travels from the upper to the lower chamber of the heart is irregular or blocked.
Basically, there is only 2 types of treatments. One, if the patient bradycardia is induced by medications that can be stopped, that would be one treatment. But otherwise, the only treatment option right now is a pacemaker.
Developed in the late 1950s, pacemakers are small devices that are implanted under the skin in the upper chest area. A pacemaker, about the size of a small pocket watch, contains a battery and computer circuitry to correct slow heart rhythms. Thin insulated wires, called leads, about the diameter of a pencil lead, connect the pacemaker to your heart. The pacemaker will only send out electrical signals to your heart when it determines that your heartbeat is too slow. When it senses a correct natural heartbeat, it will not send an electrical signal to your heart.
Pacemaker works in a very simple fashion. You can think of it as a monitor that is continuously monitoring the heartbeat, the pulse, and also actively interacting so that if the heartbeat slows down, the pacemaker kicks in to maintain the heart rate to acceptable levels. So it's a continuous loop of monitoring and intervention. These electrical signals are minute signals that are not sensed by a patient, but these signals are strong enough to make the heart beat, make the heart contract, and electrical impulses are delivered as needed or regularly according to the rate necessary for that particular patient. The pacemaker not only monitors but records all the information necessary that a physician needs for the treatment of that patient's condition. So the recording can be a short recording of 5-10 minutes, or it can be a 24 hours recording, and in some cases it can be a 3 months recording of arrhythmias in general.
This data gives your doctor the information he or she needs to control and customize the electrical signals in the pacemaker to achieve the best results for you.
Pacemaker implantation is what we call a minimally invasive procedure. I would call it an outpatient procedure. This procedure requires minimal anesthetics. A patient comes in the morning, let's say. Patient gets prepped by nursing staff, goes into a procedure room or an implant room with local anesthetics and sedation on board. A small incision, about 2-inch incision, is made in the chest wall area, and a small pocket is created, pocket that is maybe 2 to 3 inches in size. And from this pocket, a vein is identified, and usually the subclavian vein. A small wire is implanted into the right side of the heart. The wire is relatively small, looks like spaghetti, and this wire is connected to the pacemaker through a small, tiny screw, and the pacemaker wire is connected to the pacemaker unit, and this pacemaker unit is implanted inside this pocket. Usually 2 layers of stitches are needed, and the procedure is no more than an hour and 15 minutes.
Well, when we were going to go in for the pacemaker, we were both a little concerned, my wife and I, about what it would entail and what a recovery from something like that would be like, but it really went pretty smoothly. There was nothing to be afraid of that we found out afterwards by going through it.
The procedure is not painful to the patient because the patient is anesthetized and is sedated before the procedure is initiated. And post-procedure, there may be some discomfort experience that can be treated with minor pain medications.
The procedure was not painful. It was, I had local anesthetic in me, and I really felt no pain during the procedure.
The recovery depends on the patient, but most patients will recover within a few days post-procedure. The follow-up treatment for pacemaker patients is very simple. Most doctors would like to see the patient within 10 to 14 days to make sure the wound is healing properly and to answer any questions that may come up. Then the routine follow-up is usually every 6 months. Some physicians choose every 3 months, and this is done through a pacemaker clinic. It's a quick half-hour visit, which nowadays is changing to maybe even a 15 minutes visit with the advent of home monitoring.
During an office follow-up appointment, your doctor or nurse will use a special programmer to communicate with your pacemaker. The programmer collects information from your pacemaker to see how it's been working. They'll check the battery too and look at other information that may be helpful in managing your heart disease. If for some reason you can't get to the clinic for a follow-up visit, Medtronic has developed a technology that allows you to send the information stored in the pacemaker from your home to the clinic. You can easily send this information from your pacemaker to the clinic using a standard phone line. The doctor who implanted your pacemaker will show you how to use Medtronic's CareLink service.
Well, after the procedure, I had to go in every month for a while so that they would check it. And then it was 6 months. And once a year, I go into the hospital and they do a complete monitoring there.
As you get to feel more comfortable with your pacemaker, you will likely be able to return to work, travel, and enjoy your hobbies. And you may be able to go on living your life much like the one you had before you were diagnosed with bradycardia. Your doctor will tell you when you can begin to return to your normal daily activities.
My life has not been changed. I have not changed anything. I still travel and I still do whatever I want to do.
Risks associated with pacemaker system implant include, but are not limited to, infection at the surgical site and/or sensitivity to the device material, failure to deliver therapy when it is needed, or receiving extra therapy when it is not needed. After receiving an implantable pacemaker system, you will have limitations with magnetic and electromagnetic radiation, electric or gas-powered appliances, and tools with which you are allowed to be in contact. This treatment is prescribed by your physician and is not for everyone. Please talk to your doctor to see if it is right for you. Although many patients benefit from the use of this treatment, results may vary. The Medtronic Heart Help Resource Center is a free telephone-based educational resource for patients who do not have an implanted heart device and have questions about their heart condition or implanted heart devices. Our team of patient education specialists are available to answer your questions one-on-one to put you more at ease with your healthcare decisions. You can also find in-depth information on heart conditions, diagnosing heart diseases, and treating and managing these conditions at www.hearthelp.com. If you have a Medtronic pacemaker and want to learn more, call our patient services team at 1-800-551-5544, 7 a.m. to 6 p.m. Central Standard Time, Monday through Friday. An implantable pacemaker system relieves symptoms of heart rhythm disturbances. They do this by restoring normal heart rates. A normal heart rate provides your body with the proper amount of blood circulation. The pacemaker system is intended for patients who need rate-adaptive pacing or chronic pacing, or for patients who may benefit from synchronizing the pumping of the heart chambers. Risks associated with pacemaker system implant include, but are not limited to, infection at the surgical site and/or sensitivity to the device material, failure to deliver therapy when it is needed, or receiving extra therapy when it is not needed. After receiving an implantable pacemaker system, you will have limitations with magnetic and electromagnetic radiation, electric or gas-powered appliances, and tools with which you are allowed to be in contact. This treatment is prescribed by your physician. This treatment is not for everyone. Please talk to your doctor to see if it is right for you. Your physician should discuss all potential benefits and risks with you. Although many patients benefit from the use of this treatment, results may vary. For further information, please call the Medtronic toll-free number at 1-800-551-5544, 7 a.m. to 6 p.m. Monday through Friday Central Time, or see the Medtronic website at www.medtronic.com. The Medtronic CareLink monitor is a prescription product indicated for use in the transfer of patient data from some Medtronic implantable cardiac devices based on physician instructions and as described in the product manual. This product is not a substitute for appropriate medical attention in the event of an emergency and should only be used as directed by a physician. Medtronic CareLink service is currently available in the continental U.S., Alaska, and Hawaii. The Medtronic CareLink service is prescribed by your physician. This service is not for everyone. Please talk to your doctor to see if it is right for you. Your physician should discuss all potential benefits and risks with you. Although many patients benefit from the use of this service, results may vary. For further information, please call the Medtronic toll-free number at 1-800-551-5544, 7 a.m. to 6 p.m., Monday through Friday Central Time. Or see the Medtronic website at www.medtronic.com.